post-op, he did an oblique flank plasty, and we actually revised the scar here and kind of took out some extra skin. This is the patient's before picture. So if we look here, he did have a previous surgery. His main concern was kind of the excess skin here on the sides and the love handle area. Very commonplace for people wanting to address. So that was definitely done. And when we look at the back, this was kind of neglected with his previous surgery. So we went ahead and actually extended this and removed the extra skin. But look, this is 1 day post-op, you guys, once again. I mean, look at the detail here. The HD liposuction was also done to his entire torso. And you can kind of still see his markings from surgery. If you guys kind of come above, you'll see. Now there's slight definition right now, but just wait until the swelling goes down. He's also getting an IV infused. He's doing some NAD in a vitamin bag, which is gonna help replenish those electrolytes that are normally lost during surgery. And he's doing the full aftercare. As you can see, he's being lymphatically massaged. And so what we're doing is migrating that excess fluid to his lymphatic system, which is gonna help drain that further. Looking at the detail here, even underneath his chest, this is an area that also got some definition. We can see here in his before, kind of lacks the definition and shape. If we look after, we can kind of see it's already forming a beautiful shape here, and it's really going well with his torso that's now contoured and having that athletic body that the patient previously had. So the excess skin was removed, there was a lot of skin tightening done, and the contouring is just phenomenal. And again, this is 1 day post-op. He has his drains here, as you can see. The incision does go to the back, and it was connected there, so he's gonna have a tighter posterior look. So all this was taken out, you guys. This was all taken out. This was tightened. Excess skin was removed. And the patient is extremely excited, even after his first day of surgery. He'll see a lot of this swelling subside over time, and he'll be back in the gym soon enough to further enhance his tone. Now he can also do a True Sculpt Flex, which is a microcurrent that's basically delivered to the muscles to help contract and additionally tone and define these muscles here that he has underneath. The contouring was all done to the front, and look how natural that looks. I mean, it's a great subtle tone, the definition here and all around. Those love handles, they're gone. You see that? The detail is already there. You can see it from a mile away.
Is he alive? Yes, our patient is alive. He's here. He's well, and he's laughing too.
Very alive. Feeling good.
You guys, I just want to show you, this is a before. Look at the sides here, the shaping, and then look at it now. You could just see the contouring on the side is just perfect. It's masculine, it's athletic, and it just tapers in nicely. He has a wider chest, and that also has the definition. And then this is where his abdominal muscles were outlined and contoured in surgery. He has the high definition liposuction here. Again, with the Emerage technique, we can see he is looking great. If you guys have any questions, let us know, but otherwise...
How much? Someone just asked. If you want to know how much, you need to DM us your name.
Yeah, book an appointment. Yeah, book an appointment. Call us, book a consultation with Dr. Emer, and you can kind of get an idea of what the best treatment plan would be for you, whether it's non-surgical or surgical.
How much of his chest fullness will he lose over time?
His chest fullness is there pre-operatively, so he's not going to lose anything.
My chest is going to get bigger.
Yeah, his chest is going to get bigger with time because he's going to work out even
By
more.
the way, I did not hit the gym for a week before I came here, so the chest is in the small side right now.
That disclaimer, he did not go to the gym for a week, guys.
Yeah, so this is all natural here. The fat transfer was not done. He already had the muscle there, but he just had a little definition refined here. So you see what even some good techniques can actually do to enhance his previous tone. So that's what the techniques are during surgery. That's why you have to go to someone who knows what they're doing, especially with the high definition liposuction. You don't want to over-treat areas or under-treat or neglect certain areas, but you see all his area of concern was all around here and also to his back, which you don't see because he's lying flat. But stay tuned, you will see his
What
other
are his
results.
tubes for?
These tubes are actually for lymphatic, for the drainage. So after surgery, there is some excess drainage here that's leaving his body. And those will help, you know, alleviate some of the pressure, the inflammation, which he's also gonna replenish his electrolytes and fluids with the IV he's getting. So we have a vitamin bag here, and then we have his NAD infusion here. NAD is an energy molecule which is gonna help him repair and kind of expedite and reduce that healing time. That way he'll be up and about and hydrated sooner than later.
How can someone get this?
Someone can get this by making a consultation appointment and scheduling surgery, and we can give you the details of what procedures you would be eligible for and what would, you know, optimize your results, and go from there.
Does everyone get lymphatic drainage post-surgery, or is this something you need to book separately?
No, you guys, we definitely encourage our patients to book it with the surgery. It's definitely going to help not only move the fluid into your lymphatic drainage, which is basically your highway for your body to kind of get rid of excess fluids and filter the fluid. And it's really important to do the aftercare, because without that, you'd have a longer healing time. That's how people build scar tissue. This avoids all of that.
That's why we're doing the revision, because there was no aftercare the first time.
You hear that, you guys? He did not have any aftercare last time with his first surgery elsewhere, which is why he didn't have the optimal results. And this time around, we did a full surgery to his posterior, and he's getting the full aftercare, which is going to help reduce his healing time, optimize his results, and minimize scar tissue, and get rid of the excess fluid.
What are the side effects for his surgery?
There's really no side effects. He's just going to be healing over the next, few weeks, and he'll be back in the gym. Before you know it, these drains will come out anywhere from 7 to 10 days. Again, these are going to help remove the excess fluid that's in his body that was not already removed during surgery, naturally going to drain out with gravity. You guys, look, I just want to show you guys who are curious about the drains. These are called JP drains. They're squeezed because naturally this is going to want to inflate, so it's going to actually bring in pressure from the body into the bulb. So that's why we see that here. And over time it's going to fill up. And our massage therapist, Michael, here is helping not only navigate to his lymphatic system, but also towards the drain sites.
Someone's asking if we did liposuction plus skin removal. Yes, we did. And there is a great IGTV. We'll even show you the pieces of skin removed.
Yes, you guys,
Skin.
a lot of skin was removed, but just enough so that he's going to have a great result, and his scars are going to be very minimal and can be treated additionally with laser treatments here in the office. We have all the technology that we have to help reduce the pigment of the scars, and the skincare that goes along with it is going to help them heal perfectly. All right, you guys, thank you so much for tuning in, and we'll see you soon with our next patient. All righty.